My name is Grace AAV, and I am an intern with Grace Hospice. This is a private agency that provides end-of-life care to people who has an incurable illness. They treat each patient with dignity, grace, and compassion. They also provide patient and their loved ones the best of hospice. Grace Hospice is owned by Dr. Tori Clark. She is the medical director of Arbor Grace Hospice. She's also a board certified in hospice and palliative medicine. Arbor Grace Hospice is a private agency and has been around for more than 10 years. They serve over 23 counties in Georgia, and their main office is located in Fayetteville. Their mission is to provide end-of-life care with dignity, grace, and compassion to patient and their family and the families that they serve. Their goal is to provide the patient and their loved one the best of hospice. The interdisciplinary team um, is a group of healthcare professionals from diverse fields working together to provide optimal care to patients and their loved ones. The team is made up of physician, registered nurse, certified nursing assistants, social workers, chaplain, and volunteer coordinator. The care plan is to identify specific patient care needs as determined by the interdisciplinary team, ongoing assessment of and strategizing to meet those needs. The purpose of the care plan is to guide patients through the continuum of care in a seamless, safe, and effective way. In order to accomplish these goals, the plan is to clarify patient personal treatment objectives, state criteria for completing specific intervention, and track progress in meeting those objectives. The care plan requires that each discipline collaborate in assessment and reassessment, striving to integrate interdisciplinary documentation of the patient individual needs, goals, strategy, and intervention. The support group meets every third Saturday in every month. The Brave Men team, that is where I did my internship. Um, we mail out grief booklets, um, sympathy cards, and condolence letter to each deceased family members. Um, and the letter letting them know that the service that are available to them. And we track each deceased family members for 13 months. They also determine the risk level of each family members, whether they're high risk or they're low risk. Then if the family member is high risk, then it depends on their number of call that we make to them. If they're low risk, they get less calls. And um, we also document every call, everything that we do with each family members. It is documented into their solo consolo system. The semi-annual remembrance service, they keep that once per year, and I think they have one February that passed. And the grief counseling, they offer grief counseling there's four grief counseling that they offer for free to each family members, if they need it. If they need counseling, then they offer four for free. If they think they need more counseling, then they will um, suggest that they get it somewhere else, and they have to pay for, if they get it somewhere else, they have to pay for those services. Their community care service, they offer to family family members. The level of care that Arbor Grace offers, routine home care, that is the most common level of hospice care, and it is managed in the patient home. Routine home care can also be completed in a skilled nursing facility, assessed assisted living facility, and a personal home, or wherever the patient call home. Continuous home care is like 24 hours. Um, if you reach down a period of crisis that is require continuous nursing care to manage acute medical symptoms, those patients can receive continuous care, home care, which can be provided in patient home or facility where they live. Patient can receive round the clock care by licensed nurse and hospice aide until the crisis subsided. General inpatient care, which is short term, when the patient or experience acute symptoms that cannot effectively be managed in their resident, then they may receive care in the inpatient care unit. The length of the stay will be short term, and that will end when the acute symptom are effectively controlled. And the respite care and on occasional is when a caregiver need a break from caring for their loved ones. Arbor Grace offer respite care, and this is available in the inpatient unit, like general patient care, and it is short term. Respite care is available for a maximum of 5 days. Um, these are the companies that Arbor Grace is associated with, and most of their patient that comes to Arbor Grace comes from these medical institution, which is Emory Midtown, DeKalb Medical, which is now owned by Emory, and Grady. Grady, most of the patients at Harbor Grace Hospice come from Grady. And they all hospital Harbor Grace also have an office that is set up at Grady, and they also take patient. They have a area in at Grady where they take patients at Grady in hospice care, but when that is overflow, they send them to Arbor Grace. So that's where most of their patient comes from, is Grady. Arbor Grace hospice funding. Arbor Grace get most of their funding through Medicare, Medicaid, and private insurance company. Um, it's it's about $6,000 per day to stay at Arbor Grace Hospice. So you can imagine that is very expensive. And a lot of patients that comes from Grady do not have insurance. So Harbor Grace has to find like alternative, or they have to, let the patient stay there. They can't turn them away because they have a contract with Grady. So therefore, they can't turn away the patient once they come to Arbor Grace. Even if they don't have insurance, they still have to take care of them. So most of their insurance is through um, Medicare, Medicaid, and private insurance.